Hi, everybody. Welcome to this town hall on suicide prevention. I really appreciate that all of you are here. I would just like to acknowledge a couple of special guests that we have attending today. We have Broward County School Board member Sarah Leonardi with us on this town hall as a member of the audience. And we also have Westglades principal Matthew Bianchi here. So thank you very much to them for being here. And I would also like to acknowledge my legislative aide, Beth Lerner, is also on. And we have our technical moderator, assistance with everything doing with Zoom, Greg Gale as well. And with that, I would like to introduce everybody to Dr. Scott Poland. For those who don't know him, he is a professor at the College of Psychology at Nova Southeastern University, and he is a co-director of the Suicide and Violence Prevention Office there. Dr. Poland is a licensed psychologist, internationally recognized as an expert on youth suicide, self-injury, school violence, school safety, threat assessment, and school crisis. He co-authored the Suicide Safer Schools Plan for the state of Texas and previously directed psychological services for a large Texas school system for 24 years. He is a past president of the National Association of School Psychologists and past prevention division director of the American Association of Suicidology. He has been an expert witness in numerous legal cases surrounding suicide tragedies in school communities and is dedicated to prevention and has testified about the mental health needs of children before the U.S. Congress on 4 occasions. We are very happy to have him and so glad he was able to join us to present today. And with that, I will turn it over to Dr. Scott Poland.
Thank you so much, Christine. Thank you for organizing this town hall tonight. Thank every single one of you for giving me your valuable time tonight to talk about suicide prevention. Somehow I doubt that I'm the only person on the session tonight that had their life affected by a suicide. I was 25 when my father died by suicide. And you know, I'm a good example of somebody that never thought it could happen in their own family. If you lost a loved one, if you knew a young person who died by suicide, if you lost a relative, I'm pretty sure that you've gone through a great deal. Losing a loved one to suicide has been called the most complicated grief there is. And I believe strongly in prevention. And I didn't get involved in youth suicide prevention immediately after my father's death. No, it was 7 years later. And the superintendent in Texas called me into his office and he said, "What are you going to do about these suicides?" I said, I don't really know. He said, "Well, you better figure it out." And that was 40 years ago. And to be honest, I hear from somebody somewhere about youth suicide virtually every single day. And I do my best to share information and share time with them. So it is so important that we all know what to look for and what to do. And tonight, I hope to answer these questions for you. How big a problem is youth suicide? Sadly, it's the second leading cause of death for every child 10 and older. It's rare under the age of 10, but it still happens. You know what I hear from school personnel, the elementary level? Why are 8 and 9-year-old kids talking about suicide? What do we do? The answer is we have to take it seriously every single time. I've had to respond to suicides of children as young as the age of 9. And although kids under 10 are much more involved with parents, that's very protective. They have a lot less gun access. They have a lot less in terms of substance abuse problems. We still must take it seriously as it can happen. So over the age of 10, most dramatic increase has been for middle school age youth, especially girls, and for children of color. And if we look quickly at suicide across ages, it's actually the second leading cause of death for everybody between 10 and 34. So that includes college students. And I'm proud to tell you that every beginning undergraduate at NSU, Florida, receives training on suicide prevention. Suicide rates go down a bit for middle-aged Americans. They go up again pretty dramatically for the elderly. How do we know if our child's actually depressed? And to be honest, kids are always going to deny it, maybe even deny it with a trained mental health professional. But what should a parent look for? Because one of them said to me recently, oh, I think she's just preparing me for she's going away to Florida State next fall. She's moody, she's irritable. That's what teenagers do, right? Well, here are my questions. Is this persistent? Is this basically something that's gone on for several weeks or more? Yes, it has. Is it pervasive? Is it affecting home, school, peers, pretty much everything? Yes, it is. Has your child dropped out of something that was previously pleasurable? Yes, as a matter of fact, she was always on the school dance team. This year she said, I don't care about it anymore. You've probably got a depressed teenager. The literature estimates that 20% of all teens suffer from depression at some point during those tumultuous teenage years. And if you were to ask me simply, what's holding suicide prevention in this country back, is that we're afraid to talk about it. Many people believe, oh, if we bring it up, then it might cause somebody to think about it. You bring it up, it gives somebody a chance to unburden themselves, to realize, I am not alone. There is help available. So if there's one takeaway message tonight, don't be afraid to use that word and to ask directly. Would I give anything to have that last conversation back with my father? Of course. I just wished I'd have known what he was really trying to tell me with a few of his words and his behavior. I wished I would have just asked directly, are you thinking of killing yourself? And sometimes adolescents are hospitalized and they've been depressed and suicidal, and now they're back out. And most parents would be like, oh, so glad that's over. Never have to worry about that again. And they'd be very unlikely to ask. And instead, they should find that shared time and use gentle statements and just say something like, it wouldn't be that unusual to think about it again. What could you do if you ever have those suicidal thoughts again? And at the root of a youth suicide, it's untreated and it's undertreated mental illness. There's actually no great mystery to this. As somebody who worked in the schools full-time for 26 years, somebody who talks to school personnel every single day, we need a lot more school social workers, school counselors, school psychologists. Florida does not even approach the recommended ratio of those mental health professionals in schools. And also there's often what's called an adverse childhood experience. So what are those? Rejection from a natural parent, living with a mentally ill family member, living with a substance abusing family member, living in poverty, being physically, emotionally, or sexually abused, or being the victim of bullying. Those are the primary adverse childhood experiences. We don't want any child to experience those things. So, bottom line, suicide rate in America, 2019, was at a 50-year high. Now we've added a pandemic to this. And by the way, for the most part, suicide statistics are always going to be 1 or 2 years behind. But there have been some rather dire predictions made about suicide rates as a result of COVID-19. We do know that more adolescents than ever before have been taken to emergency rooms, but we don't exactly know how much the rate might have gone up. But who might be most at risk? obviously a young person with a pre-existing mental illness, but maybe they lost a loved one. Maybe their loved one was one of those 650,000 plus Americans that have died as a result of the virus. Maybe they had a great deal of difficulty with only virtual learning. We know isolation is one of the key factors with regards to suicide. Maybe that quarantine, frankly, did not go well in their family. Maybe there have been some pretty dramatic financial changes. And what are the best resources for youth suicide prevention? Can I answer that? I'm going to show you several of them. And also, there's going to be a resource list that is going to be emailed to every single participant. If you would just take a moment and look at this slide. Probably a high school senior. It's got his head against the mirror. Doesn't look like things are going too well for him. Ever since the breakup, I haven't been able to study. I just found out I'm failing. I'm not sure I want to live. Think for a moment, maybe even put it in the chat box. What would you say to that young man? I can tell you what the common responses are. I've actually had trained people say, oh, I'd tell him, you'd never want to do that to your parents. Please know that a suicidal individual is not thinking about anyone else. They're wanting to end unendurable pain. I've had other people say, I'd give them a pep talk. I'd tell them about when I was 17, something was really difficult for me and I got through it. We don't want to be dismissive. We don't want to try to say we can talk you out of this. And we certainly don't want to tell them how we understand. And by the way, as a psychologist, you know the two words I almost never use? I understand. Could I really? Not unless I experience something very much like that. And adults, I'm going to be honest, we talk too much and we need to listen a lot more. Parents, you need to find that shared time when your child is relaxed and will really talk to you. You know what I learned as a parent? When I talked too much, all of a sudden our conversation was over. So I'm hoping all of your responses were much more like this, recognizing he's overwhelmed, he's in pain, and asking directly, are you thinking of giving up? Are you thinking of suicide? You know, you're not the first person to feel this way. There's help available. I'm going to be there for you every step of the way to get you the help that you need. So, Youth Risk Behavior Surveillance Survey. This is actually the best snapshot nationally and in the state of Florida about at-risk behavior for high school students. We could talk about all of the things they survey students on, about wearing seatbelts, about drugs, about getting in a fight at school, about being afraid to come to school, about all kinds of risky behaviors. But we're concentrating tonight on youth suicide prevention. So right now, I can look out the window and I can see Nova Public High School. So for simple math, I'm going to round it off to 2,000 students. So what's this actually mean? What percentage of them actually made one or more suicide attempts in the last 12 months? You know, if my math is right, that's 158 students. You know what's really scary? For the most part, I'm going to argue the principal doesn't know. Teachers, counselors, they don't know. Parents probably don't even know. Well, who would know all about that suicidal behavior? That would be their friends. But unfortunately, most of the time, adults have never talked to kids about what to look for, what to do if you have a friend who's suicidal. So we need to talk about it more. Let me quote our Surgeon General. We got to talk about suicide prevention more at our homes and our places of work, our schools, and in our places of worship. You know what I wish? Every kid in Florida was learning in school. Suicide doesn't have to happen. It's not fate. It's not destiny. Here's what you do to get help for a suicidal individual. And kids might need this information in the sophomore year of high school. They might need it in college. They might need it on the first job. They might need it with an elderly neighbor. And in Florida, when we survey middle schoolers, their question is asked not in the last 12 months, but over their lifetime. And their responses are equally alarming. I remember being in a classroom in Liberty, Texas. Why did I go there? A kid named Keith died by suicide. Kid raised his hand and he said, I want to know something. Why weren't you here last week? If you'd have been here last week, I would have realized Keith was suicidal. I would have known what to do. Well, he pretty well summed it up. My question is, why aren't we talking with students in small groups up to the size of a classroom about the scope of this problem and what to do? We could have the next generation of young adults that would know we got to talk about it more. And you're never going to plant the idea of suicide in a kid's head. What's holding us back? I'm going to be honest. Most high school principals have never looked at the youth risk behavior surveillance survey data, and they don't know the scope of this problem. And schools, let's be honest, they have many competing demands, and they lack the needed mental health staff. You know, I was on the committee that developed the program where a Florida school could become suicide prevention certified. If you go to the website for the Florida Department of Education, we're talking about only a handful of schools in the entire state that have chosen to become certified in suicide prevention. I'm not talking about school districts. I'm talking about a handful of individual schools. And you know, one of the things that I just want to be really honest about, suicide prevention can't be site-based. You leave it up to principals, and it may not happen. It needs to come from the school board. It needs to come from our legislature. It needs to come from the superintendent. And about 20 states have mandates for suicide prevention in schools. Unfortunately, Florida is not a state with any mandates. And schools need to partner with county and state prevention initiatives. And it's also really important that parents are given information about what to look for and what to do. I like to visit a school district website. And in that search engine, I put in teenage depression or youth suicide prevention. And I wait to see what comes up. Often, virtually nothing. Or maybe I have to wade through 4 pages about wellness and I'll finally find a crisis helpline. What should come up? The warning signs. We'll talk about those in a moment. The crisis helpline, the crisis tip line, the text line, all of that should come up immediately. But maybe most importantly, who do I contact at school? I could be searching for my friend. I could be searching for myself. I could be searching to find resources for my child. So we need to find time in our presentations to parents to work in some information about recognizing the warning signs of suicide and depression. So here are the consensus warning signs for youth suicide. They talk about it. They write about it. They check out a book about it. They search about killing themselves online. They make statements about feeling hopeless about the future. Maybe they give away prized possessions. Maybe they make out a will, but they probably are dealing with overwhelming pressure and stress in their lives. And they may be withdrawing from their family, even from friends. They may have changes in their sleeping pattern. By the way, during this pandemic that we all are so frustrated with, somehow I doubt I'm the only person that would sometimes wake up at 4 a.m. and I can't get back to sleep. Adolescents in particular are chronically sleep deprived. And by the way, too many of them go to bed with the phone or the iPad under their pillow, and somebody awakens them at like 2:30 in the morning. We need to do everything possible to try to make sure our young people get the proper amount of rest. When you're sleep deprived, it's really difficult to deal with the stress in our lives. They may respond with agitation, irritability, and hostility. So how do you know? Basically, you ask. Have you ever thought about it? You ever thought about giving up? I bet you've probably had a friend that's talked about suicide. Let's talk about what you could do if you ever felt that way. Let's talk about what you could do to help a friend if they ever exhibit these warning signs. So I got a long background in this. Here are 3 projects that we did for the state of Texas. We did a project for the state of Montana. The state of Montana printed out a hard copy and mailed it to every building principal in the entire state. We have submitted a draft, the Guide to Prevent Suicide, for the New Jersey schools as well. And behind me, there's the Florida Steps. It's available online at that website. I got a donation and got help from the small and rural school districts in our state, and 1,800 hard copies have gone out. They've been mailed to basically every school superintendent in the state, but I can't make sure they actually get into the hands of the people that really could benefit from the 186 pages that are there. And schools are free to use anything that's in there in any way they wish in their important mention, their important mission for suicide prevention. So there's the Florida Steps. To be honest, it's a culmination of 40 years of working on youth suicide prevention and recognizing, of course, schools can't do it alone, but schools have a really important role to play. Kids are in our schools half the total days of the year. And that's where we need to know what to look for and what to do for suicide prevention, intervention, and sadly, postvention when a suicide does occur. So what do I believe comprehensive suicide prevention should be in our schools? Annual training for everybody who interacts with students, cafeteria workers, bus drivers, everyone who interacts with students. Policies and plans in place to make sure that everybody knows what to look for, what to do, what's the referral process in our school. Make sure that we supervise suicidal students. We do an initial screening. And by the way, that screening, you know what I think it's really all about? Can this kid, could he possibly be in a classroom right now? Or does this kid need to be right next to me until his parents pick him up, or he's Baker acted, or a mobile crisis team comes to the school to help us? And those school mental health professionals, most of the time, they've not received extensive training on suicide risk assessment and management and screening. We have to seek it out. We have to provide it. And at the simplest level, they need to see a role play of a suicide screening. They need to see a role play of parent notification and making sure parents understand how important it is to increase supervision, seek out mental health services that are community-based, and remove lethal means. Here's the bottom line. Guns account for 50% of all suicide deaths in this country. Guns are only used in 5% of suicide attempts. You know what one teenager left behind in her goodbye note to her parents? Why did you make this so easy? Why did you leave this gun available to me? And I'm not here tonight to question an adult's right to own a gun, but with that right comes a responsibility. When you have a troubled, impulsive, angry, substance abusing, mentally ill person living in your home, doesn't it make sense that you would secure the gun? So some of this just involves some common sense. By the way, there's only one exception to parent notification. You tell me you think the parents are abusing their child. Now we're calling the Department of Children and Families. And in schools, we got to identify those community-based professionals that are actually skilled in suicide risk assessment and management. It's not unusual for a kid to be in therapy in the community for being suicidal, even to be hospitalized. And in school, we find out nobody ever developed a written safety plan jointly with them. So what's a safety plan all about? What are your ideas to keep yourself safe? If you have those suicidal thoughts again, internally, what can you do? Externally, what can you do? Who can you turn to? And if I had one wish for the Broward County schools, here it is. We're into school several weeks now. I hope every classroom teacher spent time making sure every student could identify a go-to trusted adult. If kids have a trusted adult, so many tragedies could have been prevented. There's the information about the warning signs posted on district websites, information provided regularly to parents. And of course, if a student is known to have been at risk for suicide, we have to keep monitoring them. Of course, we want to keep pushing the parent to obtain mental health services, but we in the schools must also keep checking in. Oh, you lost that safety plan? Well, luckily I have my copy. What do you think we could add to your safety plan? Have you thought about any other things you could do if those suicidal thoughts ever return? And when a student is coming back from a hospital, we got to have a reentry meeting with school staff, parents, and information from the hospital. You know, how'd you like to be an AP everything? You just missed 6 school days. You know, if the school has no idea why you were hospitalized, they may not be particularly patient in needing you to make up all that work. And we're never going to get it into great details about what's going wrong in a kid's life. But if a teacher just knows depression and suicide have been a concern, here's what to look for, here's what to do. Get me involved as the school counselor. By the way, I get a call like this. The kid was typing on his computer screen. I want to kill myself. So the teacher says, go to the counselor now. Unfortunately, he went out the first exit and a frantic search ensued. Thankfully, tragedy wasn't the result, but we got to hand kids off to our school counselors, social workers, school psychologists, and then they need to be pushing for community-based treatment. Once we have all these things in place, which involve all the needed training for adults, then we can start to think about what do we say to students about this problem in a group size no larger than a classroom. I'm on record as saying, never have an assembly about suicide. they're not going to ask any questions. You're not going to get a read on how they're experiencing this information. Somebody just dashed out the back door of the auditorium. You don't even know who they are. So it's in a classroom, mental health professionals presenting, an invested teacher who's also involved. And I did one of these just last week in one of our freshman classes here at the university. I talked with the instructor ahead of time. No, you're not going to be grading papers in the back of the room. This is not a good time for you to take a break. In fact, why don't you ask the first question and be involved in this process? That's what we need. And an example, 9th grade girl raised her hand in my classroom presentation. I did exactly what you said last year in 8th grade, but that school counselor, when I told him my friend was suicidal, he made me feel like I was some kind of a snitch. So the 9th grade kid did the right thing, and the school counselor dropped the ball. So we need to make sure all the adults are trained. Then we want to use the best practice programs to actually talk with kids in a classroom size group or smaller. All right, quick quiz here. And please be thinking about the questions you want to ask me. Someone is really intent on killing themselves. There's nothing anybody can do to stop them. I think you know this is false. Suicide is preventable. The good news, no young person wants to die 24/7. The intervention of any one person, one good thing happening in their life, and guess what? Now they want to live. So suicide prevention funding, a quote from Dr. Berman, a giant in this field. It's held back because we don't fund suicide prevention. I got a call from a school superintendent in Montana yesterday. Montana is always number 1 or 2 with regard to suicide rates in the country. He says, my county allocated $0 for suicide prevention. We need to all advocate for more funding for suicide prevention and mental health. And there's a quote from Dr. Anestis, who I interviewed, the author of Guns and Suicide. What's he saying? The strongest, most powerful tool we have to prevent a suicide is remove the lethal means. Raise the barrier on the bridge, remove the gun, suicide rates go down. There's a website at Harvard. It's called Means Matter. They surveyed the research from all around the world. You do those things, suicide rates go down. 2 groups that I really want to get involved in suicide prevention. First would be physicians. The bottom line, about 70% of the time, the young person who died by suicide actually went to see their family physician. The person at any age who died by suicide likely went to see their family physician shortly before their death. I know my father did. We actually have a national recommendation, came out 12 years ago from the US Prevention Task Force. Every teenager seeing the doctor for any reason should be questioned about depression and suicide. And you would know better than I do. Are the physicians locally actually doing that? I've gone out to about a dozen communities that have experienced suicide point clusters, meaning more youth suicides than you would ever expect in a particular school or community. What's like the one group that almost never comes to the table? That would be the local physicians. They have a big role to play. And while I'm really being honest tonight, we've got to get building principals involved. Having done these presentations for 40 years, rarely are principals in the audience. So for that middle school principal that's attending tonight, I'd love to give you a high five. Thank you. Physicians, and school principals must get more involved. There's the website from Harvard, in case you'd like to check out their research. But if I was sitting there tonight, I would want to know, okay, what protects kids? What's the World Health Organization say? You know, in working with Christine and the tragedy at MSD, I said something every time to parents that I truly believe. When a kid lives in a stable home, when they're shown unconditional love every day, every way by their parents, that kid can overcome almost anything. But you know, a lot of kids don't live in a stable home. Unfortunately, a lot of kids are not shown that unconditional love. And they need coping and problem-solving skills. Our son was 8. Jeremy, I need to talk to you a little more about the death of your grandfather. Oh, I know what happened to him, Dad. You told me he had a heart attack. I mean, I'm sorry I never met the man. Son, there's a little more to this story. Now that you're 8, maybe you can understand what the word suicide means. And I want you to hear this from me, never from someone else. 2 weeks after his heart attack, he actually shot himself. The word is suicide. He said, you lied to me. No, I didn't really lie. Wait till he give you complete information. Then he thinks a while and he looks up and says, oh, Dad, you shouldn't feel guilty. Oh, why is that? Well, your dad wasn't a psychologist like mine is. He didn't teach you all the things I know about the importance of feeling good about yourself. Dad, every kid has problems. They just need to believe, go to an adult, get help, and you're going to get through it. The rest of these are pretty self-explanatory, and I've already mentioned them. Final thoughts as you're thinking about your questions. Last week was National Suicide Prevention Week. I did a 2-hour presentation for the university. We're going to send you the link to that presentation, which has a lot more detail. But everybody needs to know what to look for, what to do. Recognize youth suicide is preventable. Don't be afraid to ask and get help. Contact personnel at school. They're going to know good resources in the community. They're going to take steps to safeguard your child at school. Don't be afraid to ask. And I hope we'll all lobby for the needed mandated legislation. You know, decades ago, I testified in front of a Texas legislature about youth suicide prevention. They passed a resolution. I thought, that's great. I was really naive. A resolution means it'd be nice if you did this. We need a mandate. 2 or 3 things that every school in the state of Florida will do for youth suicide prevention. Broward County, I'm very pleased to tell you, has a suicide prevention coalition formed by the United Way. More information is available at their website. We're very lucky to have Broward's 211. You know, we can't do everything, according to Giovanni Martin, but we can all do something. And I'd like you to think about just one thing you could do. Maybe you could go to the website for the Suicide and Violence Prevention Office. Maybe you could look at some of the videos we have there. Maybe you could just glance through the Florida steps. Maybe you could have a conversation with the youth pastor at church. Maybe you could talk with your child's teacher. Maybe you could talk with the principal and ask about suicide prevention in our schools. And there's my email. And I promise you, I respond to every email I ever receive. There are a few resources, but remember, you're going to get a lot more. There's the American Association of Suicidology, the American Foundation for Suicide Prevention. NSU usually hosts the Broward County Out of Darkness Walk. Last year it was virtual. I'm not sure whether we'll have one this November or not. But you know, when I go to those and when I make a donation, and 2 years ago, I got to do the welcome family. Everybody is walking. There's the picture of the loved one they lost to suicide. There's 8 or 10 high school kids. They all have their deceased friend's picture on their shirts. They're trying to make a difference. And we can all do a lot more. And there's a wealth of resources at the National Suicide Prevention Resource Center. And these numbers, we all need to know them. In fact, it's actually very simple. I've got an iPhone here. If I push the button and I say to Siri, I want to kill myself, does everybody know what happens? Siri says, may I connect you to the National Crisis Helpline? Kids don't even have to know a complicated number. And we know it's a texting generation. You text any word, start, home, help. And a trained person is texting back to you. And I'm proud to say that some of our NSU students volunteer and are trained on the National Crisis Text Line. So I'm going to turn it back to Greg and Christine. Thank you again for listening.
Thank you very much, Dr. Poland. Really appreciate it. And just before we get to questions, we have some in the chat, and then we also have some that were submitted. I want to recognize School Board Member Debbie Hickson, who is here. I would also like to recognize Coconut Creek Mayor Becky Tooley, who is here. And I would finally like to recognize Dean Grosby, who is the wonderful Dean of the Nova Southeastern University College of Psychology. A great place and where Dr. Poland works, and they're an amazing resource to the county. So I hope everybody who's here will take advantage of the resources available. Before we get to the question in the chat, there was one that was submitted that I, as a parent of a college student, would also am curious about. How do I manage this conversation with my college freshmen without coming across as an overbearing, smothering parent? So how do you have that discussion when they're no longer in your home?
Well, a great point. Of course, if they were going to NSU, they would have already seen an online module and been a participant in an in-class presentation. You know, I think it's finding a shared time and just gently bringing it up. Just recognizing that suicide's a big problem in our country. Have you ever had a friend that talked about it? If that ever happened, what could you do? You mentioned Dean Grosby. I know that her son was instrumental at Florida State. He didn't hesitate. He got Florida State officials involved immediately when he received a text that his friend was thinking of suicide. So to be honest, all of your children, they have friends that have talked about suicide. The problem is we've never really given them information about what to do, which is realize suicides can be prevented. What's a good friend do? If Greg Gale had an elderly neighbor who started talking about suicide, we know what he would do. He would stay with them. He would get help. And we need to teach our young people to do exactly the same thing. So don't be afraid to bring the subject up.
Even if you're long distance and you can't be there for them?
I think that we still need to have these conversations.
Okay.
And if it's something really worries you, you need to go to the campus. You know, a lot's going to depend on what they say, but when you bring it up, even if it's on the telephone, you could talk to them about every university has a counseling center. There's help available. It's free. The crisis text line number, the National Crisis Helpline, they're there. So yes, we wish we could have this conversation in person, but if that simply can't happen, we can have it over the telephone.
And another question we have in the chat is, if a student is worried about a friend who does not live locally, what can they do to help? What would you recommend?
Yeah. One example I have is a young woman in Colorado. She actually contacted her friend in Virginia's school counselor. You know, she gave him a lot of good advice, but when he started talking about suicide, she knew she needed to get an adult involved. She didn't have his parents' number. She kept saying, talk to your parents, talk to your school counselor, and he didn't. So she called his school counselor. So we can reach out. In our world today, there's so many connections, and it's really easy to contact somebody and get help for them, no matter where they live.
And we have another question in the chat. It's someone whose son is in his freshman year at college. He was at the mass shooting at MSD, and he says he's fine and he would never consider harming himself. But the parents have not seen him since he went to school. They're in touch with him mostly by text. What do you suggest they do to ensure his mental health?
Well, I think it'd be a great idea to make sure there's actually some Zoom meetings with the camera on, because so often people give us clues with their nonverbal behavior. So that would be a start. You know, several years have passed. You know, we need to always look really globally at kids in terms of, do they have a good support network? Do they have some good friends? Do they have some connections to organized activities, to places of worship? Do they have some problem solving skills? Do they have a positive outlook? And, you know, I'm on record as a question that was asked when we did one of these presentations years ago, with the parent saying, I think my daughter needs counseling. She's 14. She knew a bunch of the victims. She told me she won't go to counseling. I don't know if you remember, but my answer is, that's not a decision a 14-year-old can make. You want to talk to a male counselor or a female counselor? There's a choice for you. You want me in the waiting room? You want me in the session? Now, a college student is over 18 and it's a little different. But if you're really worried, it's like, go there, have an in-person visit, contact the student counseling center, make sure your child knows what services are available. And if you're really concerned, make certain that they go to the student counseling center. And one of the tragedies that I was involved in, counseling center didn't call. That mom and dad would have had a private plane if they couldn't get a commercial flight across the country to reach their son. They were never given a chance. So at the college level, we at least need to talk with students about, wouldn't it be a good idea if we maybe talk to your parents? I've been at this a long time. I think I can get a good reaction from them. They care about you. They're part of your support system. So I like to at least not totally rule out contacting parents, even at the college level.
Okay, thank you for that. So what do you tell students whose friend may be struggling with suicidal thoughts? And I think you're right. I think we often are afraid to talk about suicide. So how do you talk to your child about talking to their friends? So if they have a friend who's struggling with suicide.
You know, a really great part of this is finding the right time. Maybe you're driving somewhere. You're on your way out to dinner. You know, your kid's not going to jump out of the car. You're going to have a chance to bring a subject up and be patient, be a good listener. And I wish parents would simply ask, have you ever had a friend with those thoughts? You ever known somebody who talked about suicide? I mean, what could you do? If that happened, how did you help them? And you hope they said, oh, I knew it was important to get an adult involved. Or if that ever happens to me, No, I'm not going to keep a secret. It's like when you care about somebody, you take steps to get them help. I'm actually a big believer in secrets, but when somebody starts talking about suicide and homicide, it can't be a secret. And too often kids hesitate. They try to handle it on their own when they need to get a mom, a dad, a teacher, a school counselor, a pastor at church. They need to get an adult involved.
And then we had several questions from teachers about what are warning signs that they can look for in their high school students, and what are some strategies they can use in the school setting.
Okay, particularly with teachers at the high school level, pay attention to what they might have written. You know, I know a poem by heart. It was handed to me one day too late. The young lady wrote all about heartache, non-existence, not wanting to be here. And what would that teacher wish 40 years later? She'd have just sat down with her and said, are these your thoughts? This worries me. You're not the first kid to feel this way. There's help available. So we need to look for clues in their writings. We need to look for clues in terms of what books they might be checking out of a library. Parents need to be looking for what websites they might be visiting. And then we're looking for changes in behavior, not taking pride in appearance, being a lot more hostile or irritable, talking about, you know, there not being a future. We need to know those warning signs and reach out. And a teacher needs to work as a part of a school team. And that's going to include a school mental health professional as well as the school administrator.
Well, thank you for answering. That was pretty much the majority of the questions that we had. Are there any final tips or things that you suggest people do next in order to make sure that they know how to have these conversations with either their students or their colleagues or their children, and you know what to do, what would be next steps?
I think it's really important for school districts to form a youth suicide prevention task force and to partner with the community services and all the important things that are going along that are with the United Way Coalition. So that's important. I think every staff member who works and interacts with students should be trained annually on the warning signs of youth suicide. One of my favorite examples was Jordan, Utah. I went there. I had 3,000 staff members, everybody from the cafeteria workers to the bus drivers to the superintendent was there to hear about what to look for and what to do. So the real question would be, why'd they do that? They had multiple suicides, and we shouldn't wait until we have multiple suicides to realize how important training for everyone is. Information on the website, easily found. Figure out ways to work signs of depression and suicide into the academic graduation plans and key messages that we have for parents all along from elementary school through middle school and high school. Find the time. And of course, you know something I learned a long time ago. When you have a presentation for parents and you call it suicide prevention, that attendance is not going to be a lot. So I want to give you an example, and it's a local one. So Pembroke Pines Charter School. We titled the presentation, Raising Children in Challenging Times. In person, we had over 2,000 because they publicized it. And of course, they got depression and suicide prevention information. We did a presentation for Pembroke Pines Charter Schools about raising children in the age of COVID-19. On that Zoom meeting, we had over 6,100 Pembroke Pines parents. They got behind it. We have a presentation tomorrow night. I'm doing it with Dr. Hillsman. And Plantation has tried to publicize it throughout the Broward schools. Again, it's raising children in challenging times, the age of COVID-19, the importance of self-care for everybody. I think we have 98 people. So think about the potential, how many people might need some good tips about parenting and self-care and the modeling they do for their child about self-care and seeking help when you need it. That is critically important. So I'm just being honest tonight, but clearly Pembroke Pines got behind these presentations. One of the things I love about NSU, we want to help our community. We volunteer. All we want is the Broward County Schools to get behind these presentations so we can really get the expertise of our psychology faculty out there to our community. So that probably gives everyone some examples of what they could do, but there's a presentation tomorrow night. It'll of course be recorded, but how can we get that word out? We try to use all of our avenues here at the university to promote things, but we need a partnership with Broward County to actually get information out.
Well, thank you so much, Dr. Poland. I want to thank Dean Grosby again as well. And I want to thank you, Dr. Poland, because there is never a time where I have asked you to come and speak. When I was mayor to our community, now as state representative to the district, there's never been a time where you said no. In fact, you say yes before I'm almost finished asking. And I never tire of hearing your stories and hearing your talks, because I think sometimes as the world gets really busy, we need those reminders to kind of be present, find those moments to talk to our loved ones, and really, like you say, take care of our own mental health and have our own self-care. So I just want to thank you very much to everybody who's here tonight. I want to remind you, we will be sending out a copy of a link to this. We will be sending out a link to Dr. Poland's 2-hour webinar. And we can also send you information on some of the upcoming programs he has. And we will send a list of resources that we have in Broward County available. If there are any questions you have, Dr. Poland, we will send out his email again, right, Dr. Poland? That's okay.
Of
We'll
course.
send you his email as well. And please reach out. We want to be a resource to the community. And thank you so much, all of you, for being here today. Your commitment to ending suicide is wonderful. And I appreciate you taking the time out of your busy schedules to be here. And with that, I hope everyone has a wonderful evening. Take care.